Obviously, acne is a real problem for a lot of patients, and it's particularly distressing for those patients who've had cystic acne for a long time, and they've got a lot of pitted marks and pitted scars running through their face. Oftentimes, those patients have really tried a lot of things. They've done all their creams, they've probably done some of the laser treatments, and they wonder what else is possible.
Yeah, for more focal areas of acne, if you have one or two ice pick scars that are kind of a little deeper, we may recommend doing some focal spot laser treatments or a subcision with putting some filler or fat underneath, which can work very well in those situations. We're going to talk a little bit more now about people who have more diffuse, kind of larger areas of acne, who've exhausted lasers and other things where they've got about the maximum improvement they can get. And as they're getting older, they're starting to see some laxity and some other things going on too. So what can you do for that?
Yeah, so this is really important. So this is not sort of a mainstay treatment for patients. I don't want people to think that you're telling them, hey, if you've got bad acne, you should go get a facelift. That's definitely not the answer that we're addressing. We're really talking now about those patients who they're really over that initial period of cystic acne. Maybe they're even postmenopausal. They're already starting to see some jowling. They've had all those other things done. They've got sort of diffuse cystic acne ice picks throughout their face where a subcision isn't going to work. In some of those patients, it does make sense to have a conversation about doing a mini lift of sorts, where basically what you're doing is an extended subcision procedure, really where a subcision is just going over a focal area and just releasing under that ice pick. If you've got sort of a diffuse area with a lot of cystic acne pitted parts, then this is what might be necessary.
Now let's be clear, we're not often recommending facelifts to 20-somethings. Okay, we're talking about patients who are usually kind of later 40s, 50s maybe, who've always been dealing with this and finally want to do something to get rid of it once and for all. So treating the acne from above with laser, and then combining that sometimes with doing a lift from underneath where we release that whole scar extensively and then are able to put that skin under stretch, you can make a really nice improvement in terms of the depth and the degree of the scar.
Yeah, and if the question is, should I do laser first or do it after the laser before surgery or after surgery, our answer is typically do the surgery first for a couple of reasons. One, once you actually get the skin on pull, you're able to get better penetration of the laser over that new stretched skin. It's going to release some of that deep pittedness, and that's going to allow that laser to be more effective. Moreover, if you do have just a little bit of redness or irritation around the incisions themselves, obviously you're going through the laser itself anyway, so you'll treat over those scars as well.